Welcome to Early Matters, the podcast on the science and policy of early childhood, hosted by Dr. Catherine B. Stevens. Early Matters features in-depth conversations with leading researchers, practitioners, and policy experts on what matters most for young children and their families to thrive.
Welcome back to Early Matters. I'm Catherine Stevens, your host and the founder and president of the Center on Child and Family Policy. Today, I'm thrilled to welcome Georgia Miartin to the podcast. Georgia has just joined the Central Carolina Community Foundation as president and CEO. Prior to this new position, she served for almost 7 years as executive director of South Carolina First Steps, which I'm really excited to talk to her about today. First Steps is a joint state government agency and nonprofit aiming to ensure that South Carolina's children, birth through age 5, are ready for school, healthy and safe, and actively supported by their families and communities. She was also the director of the Early Childhood Advisory Council, which is a multi-agency coalition of state and federally funded public entities serving young children. In that role, Georgia designed and launched a really exciting new initiative called First 5 South Carolina, which aims to use digital technology to transform the way families access public programs through a common application that provides families access to 44 different federal, state, and locally funded early childhood programs. She's been recognized for her work by Southern Living magazine, which named her one of the Southerners of the Year, has been named Nonprofit Executive of the Year, Arkansan of the Year, and a Woman of Influence by business journals in Arkansas and South Carolina. Georgia, welcome to Early Matters.
Thank you, Catherine. It's a pleasure to be here.
So as I said, you've just joined the Central Carolina Community Foundation, who is lucky to get you. But until very recently, you were serving as executive director of South Carolina First Steps. I'd love to hear a little bit more about what First Steps does, but most especially, I'm eager to hear about this really innovative new program that you launched called First 5 South Carolina, which seems to me to solve a lot of problems that families with young children face. Could you begin just by giving us a quick overview of First Steps and then how First 5 came out of that?
South Carolina First Steps is a public-private partnership. It's committed to ensuring that every child in the state of South Carolina reaches kindergarten ready for success in school and ultimately in life. And so in that capacity, we deliver direct service programs to about 55,000 children in every one of the counties of the state. And we are the provider of a part of the mixed delivery system within our pre-K system. So pre-K in private childcare centers, private schools, and nonprofit public entities, but then public schools at pre-K are run through the State Department of Education. So in that regard, South Carolina First Steps has its hands in direct service with young children, with parenting programs, with pre-K, and with meeting the needs of kids and families directly. We also provide the really important role of being the connector and convener of our early childhood state system. And so what that looks like is really leaning into our role of fixing siloed systems to make sure that they work with children and families at the center. So that's actually where this initiative that we're here to talk about today was birthed out of.
So, Georgia, when you say siloed systems, what do you mean by that?
So I shared with you the direct service that South Carolina First Steps provides, right, to 55,000 children. But what I didn't talk about was that those same children are oftentimes accessing Medicaid or WIC for food and nutrition services. They need access to childcare through federally funded childcare services. There may be a child in the home who needs additional developmental services or who has behavioral challenges. Each of those programs that I talked about from a family perspective, those are all interconnected, but from a public system perspective, unfortunately, they can feel extremely siloed, living within different state agencies, within local entities. Think about your local school district that may offer early childhood programs, or a federally funded Head Start program, a state funded parenting program, or a federal direct service to children who maybe have just lost a parent. Each of those programs have different eligibility, different government systems that are offering them, and that can feel like a maze of confusion for families who need and deserve to be able to access those programs.
If I were a low-income family with a 2-year-old, how would I go about finding out about and applying for, let's say I'm eligible for food stamps, I need childcare, and I am a young parent and hoping to get parenting support?
Every state offers programs and services that are intended to help families in need, whether that is a parenting program or whether that's a pre-K or a childcare-based program or a food and nutrition program. There's lots of different really well-intended programs that, if a family can access them, are going to transform the life of that child. But unfortunately, families don't know about them. And in that time of need, oftentimes a parent will reach out for help and find an invisible door where they're looking. They maybe find access to one program and have no idea that there are 3 or 4 other programs that could better meet their needs. And so the result is parents are frustrated with government systems that are not working for them. The systems themselves, when you think about it from a local or state perspective, are garnering resources intended to make life change, and then are not able to deploy those resources, and so have to turn those dollars back over the federal government, which no states want to do. And in the end, and this I think is the key, Catherine, children who would otherwise be wrapped in support that would get them ready for school and life success, that would meet their basic needs like food and nutrition, parents who would have access to the highest quality, most evidence-based, research-designed programs, are not getting that, and instead are wasting their time going from government office to government office, dealing with bureaucracy, filling out the same paperwork again and again. This is not the government system that any of us want to experience ourselves.
And it sounds like there's going to be a lot of inefficiency. In addition to making life difficult for low-income families, it sounds like that kind of, as you put it, siloed programs, that sort of total lack of integration between these various state offices would also be very inefficient.
That's right, Catherine. One of the issues that we experience when we have siloed systems is that we have 10 different agencies running 45 different programs, each with separate applications. Many of these are paper applications. People are having to hand key these in on the front end. If they're a parent, they're filling it out, and then a government worker is retyping it in on the back end. This is not efficient use of anyone's time, not the parent's time, not the government worker's time. And frankly, I think it doesn't lead to long-term stability for families, because if you're getting support in drips and drabs, then you're never getting all of the things that you need to be successful.
So you developed First 5 South Carolina to address this issue, a problem, which, as I understand it, exists in pretty much all states across the country, making life additionally difficult for low-income families. I would love you to describe in really concrete terms exactly what First 5 South Carolina is and how it works. And then I'd like to hear about what kind of obstacles and or support you got from stakeholders. To start with, can you just give us a picture of what the thing is? What is this?
First 5 SC is a first in the nation technology innovation that gives families with children birth to age 5 a single eligibility screener, literally one screen, just a few questions. And when those are answered, when those key eligibility questions are answered, a family finds out across a dozen different agencies and public entities, local school districts, locally funded public programs, state funded programs, and even federally funded programs. They get to find out which of these dozens of programs and services their child is eligible for. And then, and Catherine, this is really the kicker, and then they get to navigate to a common application, which is a single home where all of these different applications live and pre-fill so that if I answer the question, I have a 2-year-old and a 4-year-old, and I'm a single mom, and I'm concerned about my 2-year-old development, then I only have to answer that question one time. And I'm answering that question one time, whether I'm looking for a child's care scholarship for my 2-year-old, pre-K for my 4-year-old, or food and nutrition support for my whole family.
And is this on paper? Is this online? How does it work from the family point of view?
This is a digital platform, and most of our users come on a mobile device. Over 80% of our users are coming on a mobile device. You think about this, these are parents, sometimes grandparents, but oftentimes parents of young children. And so this is mobile friendly, but it also works on a desktop computer. We built it in such a way that it honors the self-efficacy of parents with young children. So one of the really big changes in philosophy that we adopted as we built out First 5 SC was that we believed that parents know what's best for their kids. If only they would have access to the information, and if only that information was delivered to them in a way that was streamlined and honored the fact that in many cases, these are working parents who don't have time during traditional working hours to be on a phone call for 30 minutes or an hour and a half with a government employee. That if we delivered something that could be accessed at 10 o'clock at night when 2-year-old and 4-year-old are finally asleep and I'm done with my job, then families would be able to navigate this themselves, that they didn't need the hand-holding of a government system to do that for them. They just needed government to make it accessible to them. And one thing too that I want to point out, I think just as a frame, when we talk about public programs or government programs, I think a lot of times our minds jump to means tested programs. And certainly there are many programs that are offered that are means tested, that are intended for children and families who are low income, as you mentioned. But there are also dozens of programs that are publicly available across the state or in certain geographies that are not means tested. And frankly, there are families who don't ever even knock at the door of government because they think it's not for me. And so part of what we have created is an innovative technology platform that says, welcome, welcome families, welcome if you are in crisis and need, welcome if you are a new mom who has just given birth, who doesn't think you're ever going to need a public infrastructure to support you and your young baby. Welcome in your moment of desire for the best for your child. We have something here for you. And we, as the public system, are going to make it really easy for you to find out what is available to you, what you and your child are eligible for, and then to apply in a single common application, not lots of different applications living in literally dozens of different agencies and programs.
And what I'm curious about is, prior to First 5 South Carolina, how would that have worked before First 5? Whether those are agency stakeholders, state legislators, just to get a concrete picture of this. I guess I have two questions. First of all, this sounds like such an obviously better thing that my first question is, why hasn't this happened before? And what are the blocks to this? Why this is the first time that any state has done this? What were the obstacles to doing it? Why do you think other states aren't doing it? That's part one. And then part two, who supported you and why?
You just gave us the best compliment. You said this is obvious. It's an obvious solution. And you are right. This is an obvious solution. And in fact, it is obvious to parents of young children that this is what they needed. And where this came about was in a time and place where we were motivated to listen to families. And what we heard from families was, it takes forever to wait in person in a waiting room. We heard, I am asked for information again and again. We heard, if only I had known about that program, I would have taken advantage of it, but I didn't know about it. So we were hearing from parents, we have an expectation of our public system that you, the public system, are not meeting. So let's start there with level setting, that it was needed, and parents have known for many years that it was needed. And Catherine, I'll share this. I am a mom myself to 3 young children. and was a foster parent and an adoptive parent, a parent of a child who was navigating medical challenges when we were first navigating foster care. And I myself had those experiences navigating public systems and realizing how challenging they were. So experienced that myself. I share that just to say, here's this obvious solution. What stood in the way of this happening before now? What stood in the way was that you have, in our case in South Carolina, 10 different state agencies, 79 school districts, 25 different Head Start grantees. And so now you're up into the 100 plus separate entities that have federal, state, and local funding, each of those funding streams coming from different places with different rules and regulations, different statutory compliance. And so the idea of getting all of these governance structures together to agree on a common set of eligibility criteria, to cross-reference that, to say, yes, you know what, we all have our own separate computer systems where the application's going to go in. We have our different requirements. But rather than saying it is not possible for us to meet the needs and the expectations of families, we all got together in a room in a governance structure called the Early Childhood Advisory Council that most states have. We all got together and we said, we are committed to working out the kinks and figuring out how to use technology to make this easy for families. And we, on our end, on the government end, will figure out the complexities of the back end. We're not going to make that burden of figuring out complexity be borne by parents with young children. We are going to bear that complexity.
So that sounds like a monumental job that I can only imagine was not received enthusiastically across the board because people are just doing their thing the way they've done it and they just want to keep doing things the way they've been doing them. So how did you make this happen? Who supported this?
We were really honest about our pain points. And for some of the agencies and public entities, the pain point was that we were having to go to the state house and say, you entrusted us with dollars for public expansion of pre-K, and we didn't spend all the dollars because nearly half the parents of 4-year-olds in our state don't know about us and are not applying and are not enrolled in this program that we know works, that data shows have a tremendous impact on kindergarten readiness, but yet they're not enrolled. And so we had to sort of humbly go to the state house and say, we haven't spent all your funds. Please let us keep it for one more year. So you had those examples. You had the example of a federally funded agency needing to appeal to the federal government to not have to send dollars back. That was one pain point. It was the pain point of being undersubscribed in a program that was intended to make a difference for young kids and families. You had a different issue, which is that you had some programs that had huge wait lists that were extremely fearful of opening the floodgates and having public pushback when the public realized there are not enough of these resources to go around. And yet at the same time was really having trouble making the case at the state level or local level or federal level that more funding was needed for these programs. So we said, to address that pain point, what would it look like if we could capture data and analytics about all of the people who are going through an eligibility screener and are finding that they are eligible, even if they are not capturing it? And then finally, there was another pain point, and I want to throw this out there as well, which is that even though we are in the 2020s, there are many programs ranging from local public school early childhood programs in rural communities all across the country to huge federal programs that live on paper applications. And so there was a tremendous need there to leapfrog into the 2020s. And wow, did everyone realize the need to do that leapfrog right at the moment when we were building this out, 2020 to 2022, right? COVID.
Yes.
And so really leaning into each of those different pain points and saying to legislators who were becoming aware of these pain points because their constituents were saying, this system's siloed, this system is hard to navigate. Legislators were looking for a solution. We are in a state that doesn't believe in big bureaucracy, right? Doesn't want to build out new agencies. And so the idea of a single large, new, consolidated early childhood agency, a governance solution was not going to fly here. So we said, rather than that being the answer, and that is an answer in many states, but that wasn't the answer here. Rather than that being the answer, what if instead we all came together and used technology to create consolidation for families, while on the back end, each of these programs and services still retained its uniqueness living within each of the agencies and public entities.
So it sounds like the long-time system was many, many bureaucracies at the center, with the families and children having to go around and almost serve those bureaucracies. And that what you guys did was flip that around so that the families with young children are at the center and the bureaucracies are all now focused on serving families with young children.
Family-centered design. Absolutely. Yes. Families at the center and the experience of families at the center. And so, Catherine, part of what that looked like was not just assuming that we, the government, knew what the solution was, but actually working hand in glove with families throughout the process, from inception, from listening to 7,500 families with young children all across the state in every single county and understanding what their needs were, to assembling a family voice council who said, we want to make sure that we have a stake in this, to user testing. I sat in one of these user tests with a parent group, listening as a dad said, why is that button there? That doesn't make sense to me, so that we could literally change the way that the website looked, because it didn't make sense to an actual father who was going to use it. And that work continues with families.
So how did you do that? How did you gather input across South Carolina?
We listened to 7,500 families across South Carolina. And the 7,500 were people who responded to surveys. We had focus groups in every single county of the state. And we were really intentional, not only listening to people who were accessing public programs already. We leaned into our nonprofit infrastructure and said to our local nonprofit First Steps partnerships in each of these counties, bring together families with young children who are not a part of your programs, who maybe are not accessing a child care voucher or are unaware of WIC or SNAP or a food and nutrition benefit. Bring those families in as well, because we really need to hear what their needs are. Catherine, something that came from our family needs assessment that informed this work was that when we asked families about what their biggest concerns were in their family, and we asked questions about safety in their home, we asked questions about community infrastructure, all kinds of questions, the number one thing that families said they wanted and needed in that category of family support, they said, I want more time. I want more time with my children. And when moms and dads and grandmas and grandpas are saying to a public system, I want more time with my child, it is our job to deliver that.
Yes.
And I thought back on the families that I used to work with in Arkansas who were homeless and how much time they spent waiting for a bus, getting on that bus, going on that bus to a government office, waiting for 2-3 hours for an appointment, only to get paperwork and find out that they didn't have the right documentation to ride that bus back to a homeless shelter. I thought about those families and how much time we were taking away from a mom who needed that time with her newborn baby, to build her newborn baby's brains so that that baby would grow up and do well and be successful and be hardy and attached to her mom, so that she wouldn't grow up and be a homeless parent. That's what this system does. This system says that mom living in a homeless shelter can go down the hill to the computer center, can turn on a computer at 6:00 at night when she's home from her job, and she can spend literally 3 minutes completing an eligibility screener, find out the 7 programs she's eligible for, spend another 15 minutes completing an application, can upload that documentation, and it's done. That is honoring her time. And now she can go back and hold her baby and sing to her baby and build her baby's brain. That's what we need moms and dads to be able to do.
Yeah. So how is this funded? Did you need funding? Did you get funding from the state? How did state policymakers respond to this? How difficult was it to help them understand how this would work and why it mattered?
Catherine, earlier you asked what has stood in the way of these
Yes.
initiatives in other states and other communities. Why haven't we done this?
Yes.
And one of the answers is that oftentimes the flow of state and federal funding and even local funding flows in those same silos. And so when a childcare system gets funding only to market and promote childcare, it only uses the funding to market and promote childcare. When a state entity only gets resources to be able to increase the number of families enrolled in evidence-based parenting programs, and those are the restrictions, that's all they spend the money on. So there was a visionary group of leaders who federally developed the preschool development grant birth through 5 funding stream and said, this is going to be a federal funding stream that states can use for system-wide work. Looks at a mixed delivery system as broadly defined as possible. Hey, states, you define what that means to you. And our state, we said, when we think about the whole family, the whole child, we are not only talking about early care and education, we are also talking about special needs. We're talking about food and nutrition. We're talking about health insurance and healthcare. We are talking about the entirety of that system. And we proposed in South Carolina, we said, we don't know what it's going to be called yet, but we want to use these federal funds to be able to build out a new way of integrating our system for and with families. And so that was the initial funding source. And then once that proof of concept was there, we had built it, we had the federal funding for it. Again, like that was a grant, those were short-term dollars. Then we were able to take that to our state legislature and our governor at a time when our legislature and governor were very attentive to how are we going to help families be able to get back to work. It's post-COVID now, we're coming back from COVID. How do we get families back into the workforce? And part of that solution was let's make it really easy and streamlined for families to access the services that will take care of their young children so they can go back to work, right? And so then we were able to leverage those federal dollars that were coming to an end into state dollars, which are continuous and recurring dollars supporting these efforts.
How have state policymakers responded to this? Are there any who have continued to be resistant, or have they come to understand why this matters and how it can work?
First 5 SC really hits on all cylinders for South Carolina legislators, and I'll tell you why. First, it puts parents in the driver's seat. This portal is all about parents being able to make the choices that are wisest and best for their children, right? Second, it decreases the costs of bureaucracy, the costs to employers whose team members are away from the office, the cost to government who has the real cost of rekeying in all of this data, and the cost to families, right? And third, this is a portal that takes all of the good of a public system and makes it transparent for the public. So in a place where we really believe that public systems should not be behind hidden paywalls, but that public systems are paid for by taxpayers, by you and me, and should be for all taxpayers, that is exactly what First 5 SC does. I'll share with you just a wonderful and very brief story. There was a woman who worked as an administrative assistant at the front desk of the governor's office. And she was aware of some public programs. She literally works there at the front desk of the governor's office, but she was not aware of the intricacy of the layering of all the different public services that were out there, the pre-K programs, the childcare scholarships that the younger grandchild in her household could access. And because this portal streamlined that, she was able to navigate together with her daughter how to have her young grandchildren be able to access this system. And because of that, her daughter was able to return to work. That story, that human experience of being that close to government and still not knowing, just illustrates why something like this is needed, and is not just needed for people in extreme poverty in rural South Carolina. Yes, it is there for the grandmother living in extreme poverty in rural South Carolina, but it's also there for the many, many hardworking leaders in our community who also have young children and deserve access to these publicly funded programs.
So I guess my next question is, this sounds fabulous, at least just hearing about it. It just sounds like kind of a no-brainer. As is well known, an idea is fabulous, but implementation is like 95% of the game. So this has been around now for a little over 2 years. How is it working for families? And how do you know how it's working?
We look at the universe of families with young children birth through 5. And in South Carolina, that's 212,000 households. And then we lean in and say, how many of those households visited First 5 SC? And that number in a 1-year period of time was 137,000 unique visitors. Now, these are visitors from all over the country, but the vast majority are coming from South Carolina. So you can surmise that when families need resources or are giving birth in a birthing hospital or are at a local festival and are handed a flyer, all the different ways that we have gotten the word out about this, they are coming to this portal. Now, just coming to First 5 SC is certainly not enough. And we know that in the world of websites, you're lucky if someone stays on your website for a minute. No, what we want people to do is not just stay on this website and sort of scroll around and find out about programs. We actually want our visitors to take an action. We want those parents with young children to check their eligibility. So once they go through that process and check their eligibility, we want to see, are they eligible for the programs? So incredibly, 10% of the visitors to this site, over 13,000 individuals checked their eligibility, went through that 3-minute screener, and 78% found that they were eligible for at least one program. So what that means is that I'm going from, I've never heard of food and nutrition support. I am deeply worried about my 2-year-old's behavior. And I don't know if kindergarten is available for my 4-year-old because I'm in a part of the state where I've never heard of pre-K 4. And now I've visited the site. I have found out that I am eligible for all of these programs. And then final step, 2,492 completed applications were submitted. So that means that in that first year of having that common application, those families not only found out that they were eligible, and many of them applied individually, but nearly 2,500 applied using that common application.
And have you gotten kind of individual feedback from families as well beyond numbers? Have you heard from families about how this is working for them and how they're responding to it?
I want us to hear what Katie said. Katie said, when our 2-year-old daughter was diagnosed with an extremely rare syndrome that impacted her hearing, we didn't know where to start. First 5 SC connected us to the resources we needed and coached us through the application process. Having all that information in one centralized place was key to getting the right kind of help fast. So many stories like that. Stories from families who said, and Catherine, I want to share this with you. Some of these are families who have used it like Katie did, and many are families who are feeling lost, who don't even know who to turn to for help. I'm going to share this with you. It's very brief, but I was, not only did I know how needed this was from my own experiences as a parent with fostering infants and working with homeless families for over a decade, I'm also a parent who's just out in the world, right? So I was at a big box retailer store with my own child, and there was a woman there, and she had a young child with her, and he was really gregarious and he was waving, and we got in a little conversation, right? And I said, oh, he's 4. Is he enrolled in a pre-K program? Look on her face. She said, no, I thought he would be eligible, but we went to our local school district and they said that he tested too high. So he's not going to be able to be in pre-K. He's going to have to wait until kindergarten. Well, what she had done is she had walked through one door, the one known door, which was one particular pre-K program. What she didn't know is that there are actually 4 different pre-K programs, all 4 of which have different eligibility criteria. And so I was able to say to her, standing there in the store, reached into my purse, took out the little card for First 5 SC. I was able to hand her that card. And I said, you know what? There are lots of different programs. I'm so sorry your child wasn't able to get into the one that you knew of. There are many more. Go to this site, first5sc.org, and find out not only what pre-K programs your child is eligible for, but you can also find out about a program where books will be mailed to your home. You can find out about a parenting program that will give you coaching and support and tips. You can find out about, and I kind of rambled through a few of them, and she looked at me and her eyes got teary, and she said, "Thank you so much for creating this." And she said, I thought we were going to have to wait. I thought we were going to have to wait until kindergarten, until he was 5. And I'm going to go do this tonight. She was a nurse. She was a person who was in this sector of serving people.
Right.
And even she didn't know about it.
So more generally, beyond you bumping into people in big box stores and giving them cards, what are the kinds of things that First 5 is doing to get the word out about this to parents?
This is actually one of the biggest misconceptions on building a solution like this. I think a lot of times the thought is, let's invest in great technology. This is an obvious needed solution and they will come. That is just not how it works. There is a reason that big retailers spend tons of money on advertising. And so in the early launch of this, and even to now, we have spent as much money promoting this, marketing this, pushing it out through social media, buying posters that hang in bus stops, all of the different ways that we're pushing this out. We have spent as much money pushing it out and marketing it as we did on the technology to actually build it. And we custom built this. I will share that. We worked with a developer who custom built this with our team. So this was not an off-the-shelf purchase. And I think that lowered the costs of our build. But we have needed to really lean hard into solid marketing and communications as we've built up what we call more the organic marketing. So now you can go to your local school district website in South Carolina, and in the section that says resources for families, there's going to be a link to First 5 SC. So now we're getting more of that organic buy-in. But initially, wow, Catherine, we had to really spend the resources and the dollars to promote it.
So one approach that I think I read about is reaching out to parents of newborns. Is that right?
That's right.
And can you tell me about how that works?
We tried a pilot and it went incredibly well. So the data says, where we worked with birthing hospitals and clinics that worked with families who have newborn babies. And we really leaned into their expertise and their access to families with young children. And so what we did is we made these newborn supply kits, and every birthing hospital or clinic told us what their families needed. In some cases, it was a bag and diapers and resources. In others, it was a folder with materials and a take-home book. But in each of these, there was the core information about First 5 SC. And by pushing that out to families through their trusted resource, their nurse, their doctor, their lactation consultant, that social worker, each of those people who they're already in touch with, and being able to give them that information to relay, we find that families are going there because that's the moment when parents have no idea what's out there, what they need, what to do. They're overwhelmed. Giving birth to a child is one of the major life milestone moments. And it is a time when we as a public system should be saying, we are here. We want you to thrive. We want your child to thrive. And we want to come alongside you in a supportive way on your time, at your speed, and at your discretion.
So First 5 South Carolina is obviously continuing. There's a whole team that's working on it in South Carolina. You've stepped into a new role, but you're still involved with an effort to help other states who are interested in this approach implement it themselves. Is that right? And what does that look like? How are you guys going about that?
That's right. We believe that when there is an innovative solution, it's not only for children in South Carolina, it's for children all over the country. And it's part of why, even in my role at Central Carolina Community Foundation, I'm leaning into sharing innovations that were born right here in Central South Carolina with others all around the country. And so we have philanthropic support. I'm at a foundation now. We have philanthropic support from the Pritzker Children's Initiative, as well as from Packard Foundation, who have come together to support training and technical assistance and really coaching for other state leaders, elected leaders, agency leaders, community advocates who want to see this replicated in their states. We are doing that through an initiative called First Five for All. And there's a website with lots of great tips and matrices and resources and downloadable documents that can get folks started. But then our team will also come alongside states as they navigate this journey. And Catherine, really proud to share with you that we now are working with over a dozen states across the country. And the state of Nevada has already launched a replication called First Five Nevada. So South Carolina is first in the nation, but we are so proud to say we are not only in the nation now in really solving this pressing problem for families with young children.
So working with 12 states, one of them has launched, Nevada has launched. What are the elements that are necessary in a state to make something like this work? Where would we imagine it would be more feasible for a state to implement this? And what might be the scenario in states where it's more difficult to get something like this going?
Every state is in a different phase of their development, and each state has a different need. We see that some states have the funding identified. So in Nevada, they had the funding identified. The will was there. They really needed our help with the technical know-how of building their portal and everything that we had learned, right? So we were able to really help them jumpstart. In other communities, it's how do we engage stakeholders? How do we get buy-in from our governor's office or our legislature? In other communities, it's about laying the groundwork and really understanding that without families in the center and at the table from the beginning, the pitfalls are many. And so really helping states think about how they can engage families. In some communities, they have set aside resources to be able to do the technology build. And we're having to say, that's great. You're going to need to also think about the spreading of the word, the marketing, the communications planning. We have an amazing communications team who, when you look at First Five SC, and I know we're here on a podcast, you can't see it, but one of the things that always strikes people when they come, they say, it's beautiful. Like, I'm not used to going to government websites that feel beautiful and positive and light and airy, and there aren't that many words. Well, that is by design. And so we provide a lot of training and coaching and support about how do you make this not only technically competent to solve people's problems, but emotionally responsive so that families will want to use this and will recommend it to friends and will spread the word so that over time you can spend less money on those social media buys or the paid communications.
Well, I have been on the site and I can say that it is shockingly beautiful. It's an excellent website for any website, and for a government funded entity, it's kind of unbelievable. So I encourage our listeners to go look at it, because it really goes to show that there's nothing inherent in governments doing websites that means that they have to be horrible and difficult to use.
Well, I really appreciate that. And I'm going to brag on my team for just a moment and share that the greatest internet honor is the Webby Awards. And First Five SC was a Webby honoree. And that is, I mean, that's like thousands and thousands of sites that apply for that. So just that.
Not government sites, just across the board websites.
Right. So just getting that recognition to be a Webby honoree was huge. And I am sitting in this seat now at Central Carolina Community Foundation. And I really want to share that part of why I'm still engaged with the work is that we're really proud of the innovation that's happening here in Central South Carolina that's now being lifted up all around the country and even the world. We were recognized in an international write-up about innovations coming out of countries all over the world. And we were one of two examples of the United States with technology innovations to solve pressing social issues.
Well, Georgia, thank you so much. This has been wonderful to hear about. Such an exciting model. I want to encourage our listeners again to both check out First Five South Carolina. We'll put the link to the South Carolina website, and we'll also put a link to the larger project, so that people will be able to check that out as well. It just seems like it's a groundbreaking kind of innovation that would be well worth it for states across the country to be doing this.
Thank you so much. It's just been an honor to be here with you on your podcast. I have so much admiration for all of the work that you lift up through this. Thanks for having me.
Thanks so much to Georgia for a great conversation. And thanks to you, our listeners, for joining us today. Please subscribe to the podcast so you're always up to date. Check out CCFP's work at ccfp.org and follow us on Twitter @_CCFP and @KBStevens. We'll see you on the next episode of Early Matters.
You've been listening to Early Matters, the podcast on the science and policy of early childhood, produced by the Center on Child and Family Policy.